Today we're going to talk about healthy eating for the heart and how this can help you to manage the modifiable risk factors that are related to food and a healthy diet. These include high cholesterol, high blood pressure, being overweight or obese, especially excess weight around the waist, and diabetes. Firstly, we'll discuss why high cholesterol is a risk factor. Over the long term, years and years, the bad cholesterol, called LDL cholesterol, can be laid down in the walls of blood vessels, causing them to narrow. If we have high levels of LDL cholesterol in our blood, having foods in your diet that are high in saturated fats or trans fats, which are a type of processed fat, is linked with a higher amount of LDL cholesterol. That's why it is important to follow a diet very low in these fats. The main sources of saturated and trans fats in food are animal-based foods, packaged foods, and junk food such as full cream dairy products, fatty meats and processed or cold meats, butter, lard and ghee, fried or processed foods such as cakes, biscuits, chips or anything deep fried, and plant sources are palm oil, which can be called vegetable oil, and coconut oil. We should minimize or avoid eating these foods. Our diet should consist of mainly good fats, also known as unsaturated fats. These include monounsaturated and polyunsaturated fats and omega-3s. Sources of these are olive, sunflower, safflower, rice bran, peanut and sesame oils, margarines and non-dairy spreads, nuts and seeds, walnuts and almonds are the best, avocado, olives, oily fish like sardines, salmon, mackerel, trout and herring. Next, we will explain why a diet that is high in salt or sodium is unhealthy. High salt intake can lead to some health conditions including high blood pressure. Most salt in our diet, about 75%, comes from processed foods. Only about 15% of our salt intake is added during cooking or at the table, and 10% is naturally occurring in food. Sodium intake for healthy eating is between 900 and 2,300 milligrams a day. Currently, the Australian average sodium intake is about 3,200 milligrams a day. The National Health and Medical Research Council and Heart Foundation recommend that we should reduce our salt intake to less than 1.5 teaspoons or 6 grams of salt a day, and if possible, to less than 1 teaspoon or 4 grams of salt a day to prevent chronic disease. Let's look at the Australian Guide to Healthy Eating to see how we can minimise our salt or sodium and saturated and trans fats, and eat a healthy diet to help reduce the risk factors mentioned earlier. This is called the plate for short. If you were to put all the foods you eat in one day onto a big plate and arrange them into the 5 food groups, it should look like this. The biggest groups are vegetables and whole grain and or high fibre breads and cereals. We need some fruit but not as much as vegetables, plus low fat, low sugar dairy, and lean meats, poultry, fish, eggs and legumes for protein. Outside the plate are the only sometimes in small amounts items. These are high in fat, salt and sugar and are not beneficial for your health at all. If you look at the Australian Guide to Healthy Eating brochure, you can see the number of recommended serves you need for each food group each day, according to your age group and gender. Examples of one serve for each food group is shown in pictures and described using the size and weight of a serving size of the different foods. Let us look at the serving sizes for each food group. One serve of vegetables includes half a cup of cooked vegetables, half a medium potato or sweet potato, 1 cup of salad, 1 medium tomato, or half a cup of tinned tomatoes. One serve of fruit includes 1 medium apple, banana, orange or pear, 2 small pieces of fruit such as plums, kiwi fruit or apricots, or 1 cup of diced or canned fruit with no added sugar. 1 serve of breads and cereals or grain foods includes 1 slice of bread, 1 crumpet or small muffin, half a cup of cooked rice, noodles, pasta or polenta, half a cup of cooked porridge, 2/3 of a cup of wheat cereal flakes or 1/4 of a cup of muesli. 1 serve of meat, poultry, etc. includes 65 grams of cooked lean meat, 80 grams of cooked poultry, 1 can small of fish, 2 large eggs, or 1 cup of cooked or canned legumes or beans. 1 serve of dairy includes 1 cup of milk or soy milk, 2 slices of cheese, half a cup of ricotta cheese, or 3/4 of a cup of yogurt. To sum up, try and choose the following to enjoy a healthy and balanced diet: unprocessed breads and cereals, lean meats, oily fish 2 to 3 times a week, such as sardines, salmon, mackerel, trout, and herring, fresh fruit and vegetables, low-fat dairy, unsaturated fats, no added salt and salt-reduced products. From this information, you can arrange what you will eat each day so you eat a healthy diet to protect your heart and blood vessels.